This segment sponsored by Riley Children's Health. We are continuing our series learning all about Riley Children's Health, which provides access to pediatric primary and specialty care across Indiana. And here to tell us more about their services that they provide is Dr. Alan Ladd, Pediatric General Surgeon. Good morning, Doctor.
Good morning.
How are you?
I'm doing quite well, thank you.
Good. Welcome. Happy to have you here. And really, we want to dive into just really the services that are offered at this level, the specialty clinic that gives accessibility to people in Fort Wayne. So just give us a general overview about the services that you really focus and provide in your division.
Yeah. Currently, right now, we're able to see patients locally here. We're able to set them up for consultation or preoperative assessment so that we can deal with the concerns that they have, counsel families about their healthcare issues, and determine if surgery is right for them if that's needed. Currently, we offer surgeries down at Riley Children's Hospital, but we're working toward efforts to be able to offer some local surgical care here in the community as well.
Yes, because the Children's Hospital that you're speaking of is located in Indy.
That's correct.
Correct? And so with you being the surgeon here or traveling down, are you able to perform surgeries actually at the Fort Wayne location?
Yeah, so starting next year, we actually have abilities to operate through one of the IU Health ambulatory surgery centers and basically offer outpatient surgical care there for more minor conditions.
Yes, and so under general surgery, what are some of examples perhaps of cases that you may see primarily?
Sure. A lot of what we see are routine, sort of more mundane conditions, lumps and bumps that people like to have assessed. We do a lot of hernia work for children. Adults may be familiar with that, where they'll go to a general surgeon. We're very similar for children, where we can fix conditions of inguinal hernias, umbilical hernias as well, all the way up to more advanced surgeries, as you might expect. Anything that an adult may need, a child may need it as well, and we can offer those services. And the opportunity to operate here locally allows us to take care of those more minor conditions so that families don't have to necessarily travel to Indianapolis.
Right. And so what do you think would probably be the biggest difference between your facility and clinic compared to like a children's hospital that's local?
Yeah, I mean, it's a lot more friendly environment. The clinic setting is a little bit more low-key. We have nurses that are part of our Riley family that are here up in Fort Wayne, and so we make it very inviting for the families, a little less cumbersome to navigate downtown Indianapolis, but be able to get their care here in Fort Wayne in a relaxed environment, be able to meet with us in person, and then come up with the best care plans for their children.
Yeah, and as you said, the Riley team, so everyone, you know, that camaraderie of servicing children is just such an impactful thing. And so as parents are listening and really just wanting to gain a better understanding of maybe the vibe in the environment, as they do walk into your facility, can you describe that for me?
Yeah, we try to make it child-friendly. Obviously, it's a professional building, but it's very inviting for the children. We'll have some play space for the younger children there. As they come in, we actually have it color-coded, so there's the yellow or the green wing that they can be seen in. The rooms are sort of a little more dulled so that it's not so cold and a little bit more inviting in that atmosphere. And then we have activities that they're able to participate in when they're not, or when they're waiting on me to be able to be seen.
That's awesome. And then just lastly, is there any bit of advice or tips that you can give to parents as they are really just managing the health of their child and really trying to make sure that they can do everything they can to prevent coming to see you, as lovely as that would be? We don't want that to happen.
You know, a lot of what we deal with is conditions that are out of their control. Definitely being safe practices so that they're not involved in childhood injuries, obviously, would be very important there. But what we see are conditions that they may have been born with or maybe they've developed, and it can be concerning to families that their child has a condition that may need to be seen by an actual surgeon. And what we just want to say is come to us so that we can help counsel you, find the best plan of care, and that may or may not need surgery.
Yeah, awesome. Well, thank you so much, Doctor.
My pleasure.
It's a pleasure to meet you.
Thank you.
And if you would like more information about Riley Children's Hospital, we'll have their website listed below, and I'll see you after the break. This segment sponsored by Riley Children's Health.